Hi, my name is Natalie Siebert, and this is my older adult oral video presentation. I would like to begin by giving a brief overview of my interviewee. She is a 67-year-old African American female. She does live in Pennsylvania, and I have been working with her for about a year now. With outpatient mental health therapy. We do a lot of trauma-based techniques, and we're really working together towards being able to regulate her emotions in a more healthier manner. So I would like to really just start with the stage of development that I chose to really focus on after I had completed my interview with her, and I chose to really focus on Erickson's ego identity versus role confusion stage of development. Now, typically, this stage of development occurs approximately between the ages of 12 and 18. Now, this is an approximate age range. Sometimes it's 11 years old to 17 years of age. So it does differ quite a little bit. Um, so primarily, this is a time for adolescents to develop a sense of identity, where they fit in the world, what type of person they want to be, what type of friends they want to have. And during this time, adolescents do a lot of exploration of clothing and groups of friends, and whether it be hairstyles or body piercings, different types of ways to express themselves. So for them, this is a real way to kind of find out where they fit in the world, and where they want to go in life. This is also a time when an adolescent really focuses on their self-esteem, whether or not they have high self-esteem, low self-esteem, and this is going to determine how they're going to think about themselves, and how confident they are going to be in their abilities in the future as they develop as adults. So, in talking with my interviewee, we determined that there were some factors, or some really life-changing events that happened during this stage of development for her. And the main one, and the one that she discussed in detail, was that she was sexually assaulted. So she was raped at the age of 15 years old, and this was a really, really traumatic event for her. And when looking at what that sexual assault did in terms of the Erickson stage of development, it really did have an impact on how she felt about herself, and all of these other behaviors that really happened during the stage of development. During this stage of life, she was also introduced to substances, addictive substances. So she was introduced by a peer to cocaine and began using. It started out casually and became very addictive for her. Also during this stage of life, she became very rebellious after having all of these emotions from being sexually assaulted, and began acting out in a sexually promiscuous manner. She had sexual intercourse with her older sister's husband when she was 17 years old, and a lot of interpersonal conflicts with family. And the two main family members that she discussed were her mother and her sister. So this really all played a major role in her development with having social interactions with other people, how she felt about herself, and how she did in school, and as we take a look at all of these things and look at how she developed and where she's at right now in her life, you can see how all of these things really played a major role in who she is today. So, as I said before, she was sexually assaulted or raped at the age of 15. She was a sophomore in high school. During this time, she was unable to really open up and talk about the sexual assault with anyone, and she did not even tell her parents after it happened. And as a result, she never did seek out medical treatment. And this was very difficult for her. And after months went by, she eventually told her mother, and her mom did not believe her. So when we look at the interpersonal conflicts that she had, her mom really did have resentful feelings towards her daughter, and called her things such as a liar, or just very bad names, and this played a major role in how my interviewee thought about herself. And what she explained was that she began using the cocaine more and more as a way to cope or to self-medicate from the way that she was feeling. She had a lot of feelings of anger and hatred, uh, poor self-esteem, depression, and as a result, she had a very difficult time concentrating in school. She began having flashbacks of the sexual assaults. Um, but one accomplishment that she is very proud of is that in all of this, she was able to successfully graduate high school. So she was very proud that with all of these events happening during this time of her life, during her adolescence, in all, she was able to graduate and go on. So when we look at the psychosocial crisis, we're looking at reasons for the way that she felt and how she handled the situation. So when I spoke with her, she discussed the sexual assault in detail, and how all of these feelings of worthlessness and feeling, as she said, dirty, really played a part in how she interacted with others. She began isolating herself from her peers. Her drug use progressed, and the concentration in school became just very, very difficult. She also talked about, at this time, really having difficulty regulating her emotions. So she would have very high highs and then very, very low lows, mood swings daily, where she would be happy and then sad. And that just goes into, how she dealt with who she was as a person when she was so very confused about her situation. So, some psychosocial factors that really inhibited the resolution of her crisis were, again, her emotional dysregulation, her feelings of anxiety, depression, and hopelessness. Um, Currently, she has a diagnosis of PTSD, post traumatic stress disorder, bipolar disorder, and anxiety. So these things have really stayed with her, her whole life, and she's still just managing them on a daily basis. And some other contributing factors that we had discussed in our interview were that she was a female, and at the time, many females weren't as regarded as males were. She is African American, So she feels that having been African American and a female really played a part in her being sexually assaulted, and she came from a very low social economic status. She had nine siblings, and her family didn't have a lot of money, so she was kind of just exposed to walking around on the streets and into the drugs and things like that, which led to other behaviors such as stealing and lying. So when we take a look at all of these things and how they really contributed to her development and of herself, um, she really thinks that those factors played a major role. And in continuing on and talking about some biopsychosocial factors that contributed to um, the resolution or lack thereof of a resolution to the crisis in this stage of development, we can take a look at any genetic predisposition for a substance use disorder. Um, so we had discussed in length, a history of herself and her family, and she discussed her father's alcohol use. So her father drank a lot, and this was very difficult for her growing up. So during this stage of development, she was very used to having alcohol around the house, and as I had stated, she began using substances. So it's it's something to really consider whether she has that genetic predisposition to use. And another factor that we had discussed was any mental health disorders that were present or evident in her family history. So she discussed that her father also suffered from depression. She had various aunts who had some mental health disorders. She was really unable to describe or give specific diagnoses for the disorders. However, it was very evident that, you know, there were some severe issues with mental health that ran through the family. So this could have played a part in her developing and the emotion dysregulation that she had, the traumatic event that happened, and her having um, been diagnosed with post-traumatic stress disorder and her inability to really work through, the traumatic event um, at the time. So looking at more factors that really made it difficult for resolution to occur include, um, again, poor social supports. She, had very limited friends. She had a very difficult relationship with her mother after her mom, didn't believe her sexual assault occurred. And then she had difficulty with her sister after having a relationship with her sister's husband. So this made it very difficult for her to really have those social supports. And when discussing, how well she did in school and things like that, after the sexual assault, she really had difficulty concentrating, and she describes her teachers being very unsupportive. They weren't really willing to help out, and this could be for various reasons. This could be, a racial discrimination reason. It could be because of lack of funds that school